Hello everyone, I'm Jim Longworth and welcome to another edition of Triad Today, coming to you once again from the Senior Botanical Garden in Kernersville. We'll tell you more about them later on, and later on is when the roundtable shows up and we'll get into all sorts of controversial topics, so stay tuned for that. Between now and then, some great guests, important information, but where I want to start is with the first-time visitor to the show to talk about a very serious topic, breast cancer. And we have with us right now Dr. Elizabeth Bond. She's a general surgeon with Northern Regional Hospital, and we welcome you to the show.
Thank you so much for having me.
Why is breast cancer screening so important?
Well, I think the main point for breast cancer screening is early detection. So detecting breast cancer on imaging, for example, a mammogram, prior to a woman being able to feel a mass in her breast, increases the chance of a cure.
Yeah, not wait and do it almost routinely. But now that brings me to this question. Everybody's different. So when should a woman typically, and there's exceptions which I know you'll get into, when should a woman typically start having their first, let's say, a baseline mammogram?
So as a general rule, we say 40 for women without any increased risk factors for breast cancer. So that's always a good place to start. And then as you mentioned, depending on certain risk factors, your doctor may recommend screening prior to that.
I want to come back to risk factors in just a moment, but before I forget, I know what I was going to ask you, and that's about, here we are still in the throes of COVID.
Exactly.
If someone says, okay, I heard Dr. Bond talk about this, I want to get my first screening, but there's COVID still out there, should she postpone it?
Well, for a period of time, mammogram centers were actually only doing emergency mammograms, but at this point, the majority of centers are still doing routine screening. So as long as it's available, it's important to get that baseline as well as yearly follow-up.
Now let's go back to risk. What are some of the risk factors that increase someone of developing breast cancer?
So the most common one that people probably don't think about is female gender. Women are about 100 times more likely to develop breast cancer than men, although men can develop breast cancer as well.
Right.
The second is age. So women, especially once they hit the age of 50, are at increased risk of developing breast cancer.
What about typical things like smoking? And people say, well, who cares if I smoke? But it could have an effect, couldn't it?
Yes, of course. So smoking, alcohol, as well as obesity, but separate from obesity, even physical inactivity have all been linked to increased risk of breast cancer.
Okay. Now, what should a woman do if she feels a change in her breast or a lump? Because you said before, let's don't wait till that happens. Even if she's been having routine mammograms, hey, I've just felt a lump, what should she do at that point?
At that point, she should definitely speak with her physician, likely repeat breast imaging, even if she is up to date on her screening mammograms. But make sure that the radiologist or the mammogram tech knows that there's a lump, because they might specifically target that area where you're feeling something.
I'm an old guy, and I've been at this for over 50 years, and I can tell you truthfully, I've talked to men and women when we talk about cancer, and I'm going to throw out a phrase to you and get you to react to it. When you talk about screening for this or that, prostate, breast cancer, whatever, and they'll say, I don't want to know. What do you say to them?
Well, some people don't want to know, but I would ask in response to that question, what would you want to do about it if you did know? If you want to have treatment, earlier is definitely better.
All right. Before I put up on screen, I want to put up on screen the Northern Hospital logo. But before that, I'm just very curious, very quickly, who or what sort of led you to a career in medicine? Was it a teacher, a person, was it a family member, or what?
My best friend's father is a physician. There are no physicians in my family, but seeing his practice and how he was able to help people definitely inspired me to go into medicine.
That's great. And we're glad you did, too. Up on screen, here's the information. ChooseNorthern.org is the general website. ChooseNorthern.org. Please check that out for all sorts of great information. And please do what Dr. Bond said. And if you're a woman, get that screening as soon as possible and appropriate. Doc, will you come back sometime?
Of course. Thank you so much for having me.
All right.
Appreciate it.
We'll be right back.